Welcome to the first County Commissioner's Corner of 2022, and we've already had our first blooper reel, so thanks very much for that, Brad. We are socially, physically distancing from one another as COVID is, of course, still running rampant across Summit County and the nation as a whole. So Josh, let's unfortunately start 22 off with some conversation about COVID in Summit County.
Absolutely. We finished 2021 and moved into 2022 and extended our public health order, which essentially continued making suggestions for folks to make decisions that were smart, wearing masks, of course getting vaxxed, getting their booster, etc. But as we got closer and closer to the holidays, we recognized the impacts of tourists and folks coming into our community and what that was really doing to our case rates here in Summit County and the threat that it could potentially have on our regional hospital system. And so with that, the Summit County Public Health and the Board of County Commissioners instituted a mask mandate, an indoor mask mandate, that will be a part of our public health order through January of 2022. And at that time, we'll take a look at what the numbers are. At the peak, we were unfortunately in Summit County, really in the top county in the United States in terms of case rates. And again, we think that that had to do with folks coming into our community and just sort of how much of a spread that this Omicron variant really is having, in public health. The good news is that as we go into the second week of January is that we're starting to see sort of a settling or a holding steady of numbers in terms of case rates in Colorado. We're seeing that here in Summit County, and we're no longer in the top 10, according to the New York Times for counties. So, we know that Summit County has often sort of led the way when it came to trends over the last couple of years with this, and we've seen that again this holiday season. And so the rest of the United States is starting to catch up, unfortunately, and so we'll continue to maintain that mask mandate. We've had a lot of questions about why we made that decision, and quite honestly, it really came down between what we felt like was important for our local workforce. We wanted to be able to provide that extra layer of protection for folks who are working, who are the frontline workers, who are welcoming guests to Summit County, welcoming folks coming up here, having a good time in ski country, but maybe inadvertently spreading the virus. And we needed to keep our workforce as healthy as possible. We wanted to keep our schools open as much as we could so that folks continue to work. And quite honestly, we have been crippled in a lot of areas in terms of providing essential services, whether that be transportation, bus drivers, whether that be all sorts of businesses in Summit County. They're actually having to change their hours. They're really struggling to make ends meet because they have so many workers that are out right now that are sick.
Yep, that was sort of the difference with Omicron compared to Delta and other iterations of COVID-19 is we were seeing incredible staffing shortages sort of across the board, the hospital being one of the primary concerns, but whether it was within transit or whether it was within snowplow operators or wherever else within the community, restaurants, retailers, et cetera, folks really struggling to keep their doors open just because of the staff shortages. So one of the other changes that also took place very recently was the CDC and then CDPHE, which is the state public health office, and then our local public health, changing some of the isolation and quarantine rules to try to be able to speed people back to work a little bit quicker. You want to talk just a little bit about that?
Absolutely. So the recommended quarantine was a 10-day quarantine or isolation, and now it's down to a 5-day quarantine or isolation. Now, the good news is that allows people to get back to work a little bit sooner. And the other thing that I think that sort of tips its hat to is the fact that the vaccines and the boosters are working. People are getting sick, but it's ranging from being asymptomatic to less severe symptoms and less severe illness, where people are bouncing back quicker. And the science tells us that the spread is a little bit different, and even though it's up front very contagious, folks aren't necessarily spreading it for the length that some of the earlier iterations are.
Okay.
So again, the good news is that what we knew, the vaccines are working, boosters are working, and so it is allowing people to get back to work faster. So it's that 5-day quarantine isolation.
Yep, which is huge help to the
Yes.
business community and to the county, et cetera. You mentioned vaccines and boosters. Summit County had led or was in the top 3 within the state of Colorado in terms of distribution of vaccine in the early stages. At this point, our booster delivery has been a bit slower than some other spots within the state. And so I know we're trying to ramp up some additional clinics. We've got some really large-scale clinics. We've got some state assistance coming in. But talk a little bit about the importance of folks getting their booster and then where they might be able to get that information.
Absolutely. So the information you can certainly get on our website, summitcountyco.gov, and go to the public health pages. You can see all of the places where folks can get their boosters or their vaccines if you haven't yet gotten vaxxed. It's never too late, so certainly get vaccinated. And PHE and CDC just came out and recommended that boosters are appropriate for the tweens and the teens now. Really, it has to do with that, that timing, that variance of, I think, 6 months once you've received your full dose the first time, whether it was the 1 shot of J&J or the 2 shots of the Moderna or Pfizer. But you can definitely get those boosters. And I think part of the challenge here in Summit County was that folks were having a hard time getting an appointment for a booster shot, or there was long lines, things like that, and folks were having a hard time getting that appointment. But we, to your point, Scott, working on adding appointments, working with state resources so that we really can get as many boosters out as possible. There are enough boosters available. Yep. It's just a process of making those appointments and getting them scheduled. And like every other department, our public health staff has also been hit and has been out, and the resources are limited. So thanks for being patient, but get those appointments. If you can walk in and we'll get that booster for you.
Yeah, one important piece, the state resources. So 9 to 5, Monday through Friday at the medical office building on the 2nd floor. We've set aside space for the state to run vaccine clinic. Again, 9 to 5, Monday through Friday at the medical office building in Frisco. And so certainly folks can take advantage of that. Again, all that information is on the county's website. So anything else you want to add about COVID?
The last thing, and we know, as we said earlier, the vaccines are working. Folks who are boosted, who have gotten that 3rd shot, when they get it, when we get it, right? When we get COVID, we are less ill, right? The symptoms are less severe, but that's for folks who are vaccinated. The folks who are still unvaxxed, we're still seeing cases that are severe. We're still seeing hospitalizations and deaths. So for folks that for various reasons may have been waiting, it's not too late. Definitely get vaccinated because it will help you if and when you get it. It's likely that we may all get it at some point, right? So the idea is that we're prepared when we do get it and we can fight it.
Yeah, great points. All right, wonderful. We are going to move on to winter. So it is winter.
It is
in
when
Summit
winter
County.
came.
Yep,
Since
winter
the last
came.
time we had
That's right.
Commissioner's Corner.
It did arrive, and so we want to talk a little bit about winter preparedness around personal safety, avalanche awareness, those sorts of things. So take it away, Josh.
Absolutely. We were waiting for snow, and we were just talking before this. Even the week up to the Christmas holiday, there was really no snow. But in the last 3 weeks, Summit County has experienced significant snow, and that's exciting. We love it. For those of us who want to get outdoors and play around in the white stuff, now's the time to do it. But that also means that we need to be thinking about just being prepared, having the right, supplies at hand and having good avalanche safety and preparedness. Key thing you can do is just check the avalanche forecast. If you're going to get out in the backcountry, kind of look ahead at what's being forecasted for the day. Think about avalanche terrain if you're getting, especially in the backcountry, have the right gear. We could go into a lot of the details, but Summit County website at the Open Space and Trail site has a really great sort of checklist of things that you can go, and it's a good reminder. Even the most experienced backcountry men and women can find themselves in trouble in the backcountry, and we've already seen some of these issues, and it's just the second week of January. We've already seen some avalanche issues this year.
Yeah, absolutely concerning. And then in terms of just personal safety outside of the backcountry, make sure you got snow tires, make sure you've got wiper fluid, make sure you've got a blanket and a shovel and some bottled water or whatever else it might be in your car. Because it's not unusual for the tunnel to be closed and you to be on one side of it or the other and kind of stuck and sitting in traffic. So make sure you're prepared for those sorts of eventualities as well.
Snacks, bring snacks. Have snacks in your car.
Yes, diapers if you have youngsters.
Yes.
All those sorts of things.
All the important essentials. It's a good idea.
All right, wonderful. Josh, thank you very much for joining us today. Thank you for driving me here to the studio as well. We're going to take a quick break, and Commissioner Elizabeth Lawrence is going to join me for our second segment.